wall of the gastrointestinal tract from the lower part of the esophagus to the anal canal has the same basic 4-layer tissue arrangements. The 4 layers from deep to superficial are the mucosa, submucosa, the muscularis, and the serosa, which is sometimes called the adventitia. So we'll start with the mucosa, which is the inner lining of the gastrointestinal tract, and it's a mucous membrane. So it's made up of a layer of epithelial tissues that are going to be in direct contact with the contents in the gastrointestinal tract. There's also a layer of connective tissue and a thin layer of smooth muscle. The epithelial tissues are simple columnar epithelial. Remember back when you learned this in Anatomy 1. So they function to secrete and absorb, and they line the stomach and the intestines. They secrete mucus and fluid into the lumen of the tract. And there are several types of endocrine cells too that we call enteroendocrine cells, and they secrete hormones. The submucosa is made of areolar connective tissue, and it binds the mucosa to the muscularis. So it contains a lot of blood vessels and lymphatic vessels that receive the absorbed food molecules. The mucosa can also contain some glands and lymphatic tissue. The muscularis is made up of 2 layers, smooth muscle, or 2 sheets of smooth muscle, an inner sheet of circular fibers, and an outer sheet of longitudinal fibers that run the length of the gastrointestinal tract. So involuntary contractions of the smooth muscle help to break down food and mix it with the digestive juices and propel it along the tract. And the 4th layer is the serosa. So it's a serous membrane composed of areolar connective tissues and simple squamous epithelials. So this is what we call typical serous membranes. Remember, you have a visceral peritoneum that is going to line organs, and that forms a portion of what we call the peritoneum. We're going to move into that, and we'll see that the peritoneum is the largest serous membrane, and we'll look at the difference in the visceral and the parietal peritoneum. All right, so here in this image you see the peritoneum, and it, as I mentioned, is the largest of the serous membranes. It's divided into a parietal peritoneum that you've already learned is going to line the cavity, and a visceral peritoneum that's going to cover some of the organs in the cavity and makes up their serosa, or their serous membrane. This is going to be filled with lubricating serous fluid, because remember, these are serous membranes. They secrete serous fluid into the peritoneal cavity. There are certain diseases and disorders where the peritoneal cavity can become distended when you have the accumulations of a lot of fluids in there, and that condition is called ascites. Now, unlike the pericardium and the pleura, which line the heart and the lungs and smoothly cover the heart and the lungs, the peritoneum has a lot of folds that weave in and out between the viscera. And these folds help to bind the organs to each other and to the walls of the abdominal cavity. They also contain blood vessels, lymphatics, and nerves that supply the abdominal organs. So, when we look at these folds, we'll examine some of these that you'll see in lab when you do your dissections. One of those is the greater omentum, and it's the longest of the peritoneal folds, and it drapes over the transverse colon and coils the colon and the coils of the small intestine, and sometimes just looks like a fatty apron that lays over the intestine. So it has a lot of adipose tissue, and it can expand when there's a lot of weight gain, and also helps to contribute to what we see and commonly call a beer belly in some overweight people. There's also a part or a fold of the peritoneum that we call the mesentery, and it's sort of a fan-shaped fold that binds the jejunum and the ileum of the small intestine to the posterior abdominal wall. It also has a lot of adipose tissue and helps to contribute to the large abdomen that we see in obese individuals. Now, we have a lot of blood vessels and lymphatics and lymph nodes that are also going to be a part of that mesentery, and again, you can see this when you do those dissections in lab. Peritonitis is when there is an acute inflammation of the peritoneum, and sometimes it's caused by infectious bacteria, or it can result from accidental or surgical wounds in the abdominal wall, or from perforation or rupture of microbe-containing abdominal organs, because we've got microbes that live in our gut, right? So if they're able to escape because of something that has ruptured these organs, then peritonitis or that acute inflammation can develop. There's a less serious form of peritonitis that can simply result from rubbing together of inflamed peritoneal surfaces that are covered by those layers. In the mouth, those first of the 6 processes of digestion begins. This is where ingestion starts. We bring food in to the mouth. The mouth is formed by the cheeks that form the lateral wall of the oral cavity, and the lips, which line and provide a open and closing access to the mouth. So you have superior lips and inferior lips. You also have the hard palate of the mouth, which is going to be formed by the bones and the soft tissue that cover. So as you learned in Anatomy 1, the palatine process of the maxilla and the palatine bones form that upper hard palate. Your soft palate is going to be a muscular roof of the mouth that forms the rest of the roof. You've got the uvula, which is the little hangy down thing. It pushes up when we swallow food and prevents food from entering the nasal cavity. You have the tongue, which is going to be used to manipulate and move food around the mouth. It also aids in swallowing and shaping food into a bolus that we can push down into the oropharynx, and also that's where our taste receptors are going to be located. You have your teeth, your molars that are going to crush and grind, your premolars that also crush and grind because of their flat surfaces. You have your canines that are going to rip and tear, and your incisors that cut food and get that initial bite, especially if you think of biting into something like an apple. In addition to this, we have the gingivae, or the gums, that help to anchor the teeth in their sockets in the maxilla and in the mandible. You have the opening here of your submandibular salivary glands, and you have other openings for salivary glands that you can't see in this image. But remember, the mouth is where we take food in, formed primarily by the cheeks, the hard and soft palate, and the tongue, and then all the accessory structures that help us to chew that food and move it around in the mouth to prepare it for swallowing. The salivary gland is pretty easy to understand. It's a gland that releases saliva into the oral cavity. Now, under normal conditions, just enough saliva is secreted to keep the mucous membranes of the mouth and the pharynx moist and to cleanse the mouth and the teeth. But when food enters the mouth, secretion of saliva is going to increase, where it lubricates and helps to dissolve the food that we put in, but also begins chemical breakdown of the food. So we have 3 sets of salivary glands. The parotid salivary glands, par means near, odo means ear, so near the ear. They're inferior and anterior to the ears, just between the skin and the masseter muscles. So the parotid gland is going to have a parotid duct that pierces the buccinator muscle into the mouth, into the oral cavity. Your submandibular gland, submandibular, found on the floor of the mouth under the mandible. So they're medial and partially inferior to the mandible. And then you have your sublingual glands. So these are beneath the tongue and superior to the mandibular glands. They secrete through a duct that opens onto the floor of the oral cavity. So what is saliva? Well, it's about 99% water and about 0.5% solutes. It contains ions, sodium, potassium, chloride, bicarbonate, phosphate, also some lysozymes, salivary amylase, and that salivary amylase is an enzyme that begins to break down starch, but not all salivary glands supply the same ingredients. The parotid glands secrete a very watery fluid containing that salivary amylase. The The submandibular glands secrete a fluid that contains amylase, but a lesser amount, and it's really thick with a lot of mucus. The sublingual glands secrete mostly mucus and just a teeny tiny little bit of salivary amylase. So that amylase starts the breakdown of starch in the mouth. Bicarbonate ions and phosphate ions help to buffer acidic foods that we may eat. Mucus lubricates the food so it can be moved around in the mouth easy and helps us to form a ball or a bolus of food which can be swallowed more easily. The secretion of saliva is controlled by the autonomic nervous system. So when food is put into the mouth, the parasympathetic stimulation promotes secretion of a moderate amount that is going to be affected by the sympathetic stimulation that helps us to decrease the amount of saliva. So the salivary gland stops secreting saliva when we become dehydrated under the control of the sympathetic nervous system to help us conserve water, and that results in dry mouth and gives us that sensation of thirst. The taste and the feel of food are stimulators of salivary secretions, but even the smell or the sight or sound or even thinking about food can stimulate the secretion of saliva. The tongue is an accessory digestive organ. It's made up of skeletal muscle covered by a mucous membrane. The tongue and its muscles make up the floor of the oral cavity. It attaches inferiorly to the hyoid bone, the styloid process of the temporal bone, and the mandible. There are muscles that move the tongue from side to side and in and out to maneuver food from chewing, to shape that food into a bolus or a ball, and to force the food to the back of the mouth for swallowing. In addition to that, there are other muscles that change the shape and the size of the tongue, and we use that for speech and for swallowing. The upper surface and the lateral surfaces of the tongue are covered with papillae, which are little finger-like projections that are covered with stratified squamous epithelial cells. Many of these papillae contain taste buds, which are our taste receptors. Some papillae don't have the taste buds, but they contain receptors for touch, and they also help to increase the friction between the tongue and the food, making it easier for the tongue to move food around in the oral cavity. There are lingual glands that are in the tongue that secrete a mucus and a watery serous fluid that contain an enzyme called lingual lipase that begins action on about 30% of dietary triglycerides, which are fats and oils, and convert them into just simpler fatty acids and diglycerides before they enter the rest of the digestive system. Your teeth are accessory digestive organs as well, and they're located in the sockets of the alveolar processes of the mandible and the maxilla. The alveolar processes are covered by gingivae or gums, and those gums extend just slightly down into each socket, and along with the periodontal ligament, they anchor the teeth to the socket walls. A typical tooth has three major areas: the crown, which is the visible portion above the level of the gums. Embedded into the socket are the roots, and the neck is sort of the constricted or narrowed region at the junction of the crown and the root, very near the gum line. Humans have two sets of teeth, deciduous and permanent. The first, the deciduous teeth, are what we commonly call the baby teeth, and they tend to erupt or show up out of the gingivae about 6 months of age, and approximately 2 teeth appear each month once eruption begins until all 20 of those deciduous teeth are present. The incisors, which are closest to the midline, are chisel-shaped, and they're made for cutting. Next to the incisors, we have the canines, and they have a pointed surface, and they're used to tear and shred food. Posterior to the canines, we have the molars and premolars, which are used to crush and grind and prepare that food for swallowing. All of the deciduous teeth are lost, generally beginning about age 6 and until about the age of 12. And then they're going to be replaced by the secondary or permanent teeth, and we have 32 of those. When I'm teaching teeth, I always like to remind students of the principle of complementarity. Remember, that's form and function and the role that they contribute to each other. Think about your teeth and the shapes of your teeth and where they're located. You have those incisors in the front, sharp chisel-like teeth that are used to bite, to tear food off. Think about eating corn on the cob or an apple. What if your molars, those flat surfaces, your crushers and grinders, were in the front and your incisors were in the back? Wouldn't work very well for the way we eat, would it? So this is a perfect example of the principle of complementarity, form and function. Now that we've seen most of the organs in the mouth and the accessory structures and how they're going to begin this process of ingestion and preparing the food to be swallowed, let's talk a little bit about the mechanical and chemical digestion in the mouth. So mechanical digestion in the mouth occurs because of the chewing or mastication, where food is manipulated around by the tongue and ground up into small pieces by the teeth and mixed with saliva, so that you form a soft, flexible mass called a bolus that we can easily swallow. Food molecules begin to dissolve in the water that's a part of the saliva, and that's an important activity because enzymes can only react with food molecules in a liquid environment. There are two enzymes, salivary amylase and lingual lipase, that begin chemical digestion in the mouth. The amylase is secreted by the salivary glands, and it's going to start the breakdown of starch. Dietary carbohydrates are either monosaccharides or disaccharide sugars or complex polysaccharides called starches. Most of the carbs we eat are starches, but monosaccharides can be absorbed. Only monosaccharides can be absorbed into the bloodstream, so we got to break them down. The function of that salivary amylase is to start the digestion of starch by breaking it down into smaller molecules such as disaccharides or even short-chain glucose polymers. Food is usually swallowed too quickly, though, for all the starches to be broken down in the mouth, so the process can begin in the mouth. Saliva also contains lingual lipase, which is secreted by the lingual glands in the tongue. And this enzyme becomes activated in the acidic environment of the stomach and starts to work after food has been swallowed. So it breaks down dietary triglycerides, fats and oils, into fatty acids and diglycerides. When the food is swallowed, it passes from the mouth into the pharynx. Remember from our study of the respiratory system, the pharynx is a funnel-shaped tube. It's going to extend from the internal nares to the esophagus posteriorly and to the larynx anterior. So when we focused in the respiratory system about the anterior part of the pharynx, now we'll look at the posterior because that's where food is going to pass through into the esophagus. So the pharynx is composed of skeletal muscle. It's lined with a mucous membrane. It's divided into the three parts we've seen before: the nasopharynx behind the nasal cavity, the oropharynx behind the oral cavity, and the laryngopharynx, which is going to lead down to the larynx. The nasopharynx only functions in respiration, but the oropharynx and the laryngopharynx have digestive as well as respiratory functions. So food is swallowed and it passes from the mouth into the oropharynx and laryngopharynx, and then muscular contractions of these areas are going to help to propel that food into the esophagus and then down into the stomach. This slide and the next slide are going to give you a summary of the things we've talked about that happen as a part of ingestion. So the teeth, the tongue, the lips, the salivary glands, the cheek, the taste buds, the lingual glands, and the teeth, and the way that they play a role in the digestive system. So I encourage you to read over these. Of course, you know by now I'm not going to read you a table. These are included just to give you a nice little summary of these structures. I do want to talk, just briefly about some homeostatic imbalances associated with the structures associated with the mouth. Mumps is caused by a virus, and it typically attacks the parotid glands. So mumps is an inflammation and enlargement of the parotid salivary glands, and it's usually accompanied by fever, general discomfort, extreme pain in the throat, especially when you try to swallow sour foods or acidic juices such as orange juice or lemonade. Swelling can occur on one or both sides of the face, usually just anterior to the ramus of the mandible. In about 30% of males past puberty, the testes can also become inflamed. Sterility rarely occurs, though, because testicular involvement is usually unilateral and only involves one testis. So even if the one testis is damaged to the point that it stops producing sperm cells, the other one can still produce sperm cells, so the male can still reproduce. Vaccination became available in 1967, so the incidence of mumps has dramatically decreased in those that do receive the vaccination. Dental caries are what we commonly call cavities, and this results from demineralization of the enamel of the tooth, so that bacteria can get into the tooth itself and start breaking down even more. So the bacteria metabolize, and they metabolize the sugars in our diet, and as they do so, it creates acids, and these acids can then eat into the tooth and create those holes. Periodontal disease is a general disease that refers to the inflammation and degeneration of the gingiva, or the gums, the bones, and the periodontal ligament. This can lead to bleeding gums, gums that recede from the tooth and swell. It's usually the result of poor dental hygiene, but can occur due to smoking or other irritants that provide an irritating action and inflammatory response of the gums. A canker sore is when the oral mucous membranes ulcerate. This can be because of an autoimmune disorder, or also some allergies can lead to these. Oral herpes is caused by the herpes simplex virus. So blister-like lesions occur in the mouth, most commonly on the lips. They can spread. Because this is a virus, it can be treated, but there is no cure. And halitosis is simply bad breath. So certain foods or drugs and diseases, or even just poor oral hygiene, can lead to an unpleasant odor that comes from the mouth.